Equality, diversion and inclusion. So whilst we are in the midst of the longest doctors' strike in history, with an NHS buckling under the pressure, we've had strikes pretty much across the board. Nurses who definitely deserve better pay, who settled on a deal but then got annoyed when consultants who were paid over 100k went on strike and secured even more money. Earlier last year, we had the ambulance workers, and so it goes on. And this has pushed the waiting lists up further, with people's lives being destroyed, many dying as a result. And in the midst of all of this, someone, somewhere, I'm guessing in the EDI unit, Equality, Diversion and Inclusion, which is what I like to call it, has been paid money to come up with this claptrap. An online registration portal called MyChart, introduced into Guy St Thomas NHS Foundation Trust and King's College Hospital NHS Foundation Trust, where patients are being asked to choose from 159 religions, 12 genders and 10 sexual preferences before they attend a hospital appointment. Now, some of the options on the list include Goddess, Druid and Satanist, which I'm presuming are religions, although they could be sexual preferences or genders. This is wokery on a scale beyond belief, and the last place where you expect to see delusion trump biological facts. There are only two genders, and that is a very relevant and a very important piece of information when treating patients and also determining which ward they should be on. Yet the form offers a dozen, which include questioning, agender, demi-boy and demi-girl. I mean, what the hell are they? For God's sake, this is ridiculous and totally pointless. And why on earth do we need to know someone's sexual preference? And what has that got to do with anything when you're in hospital? And just to make sure that they ask the all-important question as to what sex you actually are, because that's what they really need to know, the form also asks for your sex assigned at birth and your legal sex. I mean, this is clearly about satisfying some ideological nonsense that is not based in science at all, and the last thing you would expect from a healthcare system where biology matters. And I suspect it's also about justifying the existence of the role of EDI, where many working within it are paid considerably more than the frontline staff. Lottie Moore, head of Biology Matters and Gender Identity Ideology, says that gender identity ideology has been stitched into the very fabric of our public health system without public consensus. When it comes to healthcare, biological sex is vitally important, and it is crucial that NHS trusts know the sex of their patients. Now, of course, other NHS trusts are using the system with fewer options, but it's still madness, with some NHS chiefs on over 300k heading up some of the most failing trusts with record waiting lists. The NHS needs a serious spending rethink, and the first thing that is surplus to requirements is equality, diversity and inclusion.